Good morning, and welcome to Medicare the Basics, sponsored by Hogue and Paterka Insurance. Hello, my name is Dan Paterka. I am an independent broker and a member of the Hogue Senior Services team. We have an agency here in Newport Beach with 10 agents, and we're here to answer any questions that you might have about Medicare, including Medicare Advantage plans, prescription drug plans, and supplements, all of which we'll talk about in just a moment. Collectively, our team has over 100 years of experience in the healthcare industry, and we're here to help you make informed decisions about Medicare. We have a lot to unpack today, so let's just get started. An overview of what we're going to talk about, what I will talk about, some general information, a quick summary of Medicare, the parts of Medicare, we'll look at those a little bit more deeply. There are entry points into the Medicare system, and we call those election periods. We'll talk about leaving employer coverage because that's one of the election periods when you leave employer coverage if you're older than 65. We have coverage options that will kind of wrap up everything together, and then I'll leave you with some contact information if you have further questions. We are now with 17 days left in the annual election period, which we're going to talk about. And so you have the 17 days within which to make a decision about what you're going to do for 2022 with respect to two parts of Medicare. I'll leave you the office number at the end. So general information. You are considered to be a beneficiary under Medicare's rules. This is not talking about wills, trusts, or estates. So if you see a form that says beneficiary signature, that relates to you. An authorized representative is someone to whom you've given power of attorney. And so you are not an authorized representative unless you are the one who has power of attorney. You are not the only one getting this mail. In 2019 BC, before COVID, I would go to people's homes and they would pull up an orange crate and it would be filled with mail. And they'd say, of all this information, what do I really need? Well, the honest answer is that there are two agencies that you can trust to give you reliable, if somewhat vague, information. They are the Centers for Medicare and Medicaid Services, which is abbreviated CMS, and I call it just Medicare, and probably what you know it as, and then the Social Security Administration. These are the two agencies that's the mail that you want to keep. Everything else is fluff designed to get you to call an insurance company or an insurance agent or broker so that they can sell you a policy. CMS, Medicare, is charged with the oversight and regulation of our industry, and they are there for your protection. They want to make sure that whether you're 65 or 105, no one's taking advantage of you. They're not calling you at 6 in the morning. They're not buying you a meal so that you feel obligated to buy a policy from them. And so Medicare wants to make sure that you're protected. A word about sales agents and brokers. A sales agent is someone who works for a carrier, an insurance provider. A broker is someone who represents you. We look at all the different plans that are available to you, and we can provide suggestions and comparisons, whereas an agent is just going to give you that company line. So you're going to a Ford dealership, you're going to get the entire line of Ford products. That's what an agent does. We're more of a broader approach to selecting your Medicare. Whenever you meet with an agent or a broker, on an individual basis, that's over the phone, in person, at a Denny's, your home, even a library, we're going to ask you to sign what's called a scope of appointment. It is a permission slip from the government, and it says, Dan can talk to me about one of 4 or 5 different topics, but they're all related to Medicare. If you only want to focus on prescription drug plans, you check that box. These forms are standardized, so there's no need to really be concerned about them. And on them, you will see a line that says beneficiary or authorized representative signature. Okay, so that's the scope of appointment. No matter who you talk to, someone gets paid for the work that they do in getting you on board to a policy. And so if you call the company directly, that person, that individual, is going to get paid, that telephone person. If you work with a broker, we get paid for working with you, for signing up. There is no fee involved with working with a broker, nor with calling the insurance company directly. So you never have to pay a fee to get advice. We're licensed by the state, and we're certified by the companies that we that we represent annually. So we always know what the most current information is regarding that particular carrier. Medicare is health insurance for people who are age 65 years of age and up. You could be under 65 with a permanent disability, that's 2 years or more, on Social Security income. You could also have end-stage renal disease, that's stage 4 or stage 5 when you're on dialysis, and Medicare will send you a card automatically after 4 months of dialysis. The Social Security Administration, one of the agencies that I told you could trust, is charged with the enrollment and billing for Medicare. So they get you on board, and once you're on board, Diana, could you get me some water, please? Once you're on board, the Centers for Medicare and Medicaid Services is charged with the rules and plan designs. Excuse me. Right here you can see a Medicare health insurance card, and this person has Part A and Part B of Medicare. Okay, so a quick look at the parts of Medicare. Medicare has 4 parts and 4 parts only. They're lettered A through D. Part A is considered acute care. It is called hospital insurance by Medicare, and you're automatically entitled to Part A when you turn 65 or those other 2 things that I was talking about. Thank you. You've paid into a trust fund through your working career, and so that money is set aside for you then. Part B is called medical insurance by Medicare, and it's everything out of hospital. It's the basic stuff, the day-to-day. You do not have to sign up for Part B if you don't want to. However, if you don't when you should, you may get penalized, and that penalty will go with you for the rest of your life. A and B together are known as original Medicare. It's also called straight or traditional Medicare. Part of the confusion related to Medicare is that Medicare uses different terms to mean the same thing and similar terms to mean completely different things. So after today, you should have a better understanding of these terms, and when that term comes up, you'll know what the other person is talking about, even if they don't explain it to you. Okay, so Part B, voluntary enrollment, you've not paid into a trust fund, it carries a premium. You can only get A and B through the Social Security Administration. Remember, they're charged with bringing you on board. We can help you in our office to get you set up on Social Security and Medicare, but we can't do it for you. We have to work together to get that done. Part C, these are called Medicare Advantage plans, and they are an alternative to original Medicare A and B. You don't have to sign up for Part C plan if you don't want to. There's no penalty associated with it if you don't. Part D, subsidized access to drug coverage, like Part B, also voluntary enrollment, also a penalty if you don't sign up when you should. Parts B and D, Bravo and Delta, they also carry what's called an income-related monthly adjustment amount. If you earn over a certain amount of money, then you're going to pay more for Parts B and D. We'll talk about that in a second. So a little bit deeper dive on Part A. Excuse me. It includes a hospital stay. If you go to the hospital, first money out of pocket is going to be yours, and they call that a deductible. The deductible for 2022 is $1,556. If you go 3 times in 1 year for 3 different things, you're going to pay close to $4,600. One of the issues with original Medicare is that there's no upper limit to the amount of money that you'll spend as a beneficiary. So we look for ways to hedge that, and we'll talk about those ways in a second. Skilled nursing facility, you'll pay $194.50 after day 20. So Medicare will allow you to stay for the first 20 days at no cost, but after that time frame, you're going to start paying for it, up to day 100. At day 100, Medicare is going to look at you and say, have you showed continuous improvement? If you haven't, we're going to cut you loose because you need some different care, long-term care, which Medicare does not provide. It includes hospice, Part A does, if a doctor orders it. It also includes home health care, far less expensive to have a nurse come to your house and change your dressing or give you an intravenous injection. So it includes home health care, and after the first 3 pints of blood. So you can see that Part A is really a catastrophic type of coverage. It's a safety net. Part B, which you pay a premium for. It includes ambulance rides, surprisingly not covered under Part A, but you're not in the hospital, so it doesn't cover that. Part B does. Physician visits, that's primary care physicians and specialists and so on. Outpatient hospital services like colonoscopies, knee, shoulder, hip surgery, things of that nature. Labs and diagnostic testing, CT scans, MRIs, PET scans, things like that are all covered under Part B, and durable medical equipment. All right, under Part B, you have a single deductible every year. It's $233 in 2022. These amounts, these deductibles, they change every year, and so you have to be sort of aware when they make those changes. This year it was announced on November 11th what the new amounts would be. After you pay that deductible, now your benefits kick in. You'll pay 20% of whatever Medicare allows a provider under Part B to charge. So let's take an example. You have paid your deductible for the year in whatever fashion. You go to a provider and they say, oh, that's going to be $200 for this procedure, this visit. They send the bill to Medicare, and Medicare sends the bill back. And they say, hey, you know what, we only allow you to charge $100 for this procedure. Here's $80 from us, Medicare, and you can get the other $20 from Dan. Now, that's all well and good unless you find a provider who doesn't work with Medicare. They will bill Medicare for you. And in that instance, they can charge up to 15% over the allowed amount. Now, that's not a lot of money when we're talking about a $200 charge that's knocked back down to $100. It's $15, right? 15% over the allowed. And that's what you're responsible for. There are only a couple of providers that will charge you under Part B an excess charge, and those are anesthesiologists and emergency room docs. Now, there may be other ones as well, but those two are known for doing it, and whatever 15% of a large amount is, that's what you're going to be on the hook for. So you need to be aware of this Part B excess charge under original Medicare Part B. For Part B, all of those good things that you get, you're going to pay $170.10 a month in 2022. That is the base premium. As I mentioned on that earlier slide, though, there's an income-based surcharge, and your premiums could go up to $578.30, where everyone else is paying $170.10 per month. So if you have an income over $91,000 as an individual, and that's based on 2019 income, or $182,000 married filing jointly, you're going to be subject to this income-based surcharge. And remember, I said it was on Part B as well as Part D prescription drug coverage. So that income-based surcharge can be a factor in an instance for an election period. If you're paying for Part B, if you're on Medicare, you're going to pay for Part B in most instances, and that premium will be deducted from your Social Security benefit. If you're not drawing Social Security income, they will bill you every 3 months. So there might be a true-up to get you on the same quarterly basis as everyone else, but it's $170.10 per month. Part C, Medicare Advantage. This is the alternative to original, straight, or traditional Medicare Parts A and B. You can go on to a Part C plan, and you'll have all the benefits that you would have received under A and B, and then probably some extra things that they throw in. You do have to continue to pay for Part B. That's your foundation, A and B. And so once you paid A and B, you can move into a Medicare Advantage plan if you desire. Medicare pays an insurance company on a monthly basis to take care of all of your medical needs. Most of the Advantage plans are HMO. You would pick a primary care physician who takes care of you, and your primary care is limited to a specific geographic area. In the Medicare world, it's by county. So if you reside in Orange County, those are the benefits that will accrue to you signing up for an Advantage plan in Orange County. You always have worldwide and urgent care coverage, however, with the Advantage plans. What is urgent care? Urgent care is you're having a Thanksgiving dinner, you're helping daughter chop the onions, and you cut your finger and you can't get it to stop bleeding. It's not going to kill you, but it does need to be taken care of. That's urgent care. Emergent care is I'm having chest pains, I don't know what's going on, I need to go into the emergency room and get it checked out. So you always have that type of coverage with an Advantage plan worldwide. You choose a plan based on the benefits. The prescription drug coverage is very important, cost sharing, and the network of doctors. Your doctor needs to belong to that network, and you promise to stay within that network in order to get your benefits. The benefits are great, of course, because they include lifestyle as well as anything that you would have gotten under Parts A and B of Medicare. The Advantage plans also include prescription drug coverage in most instances. Part D is coverage for outpatient prescription medication, the kind of medications that you would get at a CVS, a Walmart, a Walgreens, things like that. There are a number of different plans that are available. In California this year, there are 25, and Medicare, in charge with the rules and regulations, they determine an average premium on an annual basis, and they call that the base beneficiary premium. For 2022, the base beneficiary premium is $33.37. They use that as the basis for a penalty if you don't sign up for Part D when you should. There is an income-related adjustment for prescription drug plan
Sorry, I couldn't hear what you said.
I'll have to speak louder. So let's see, there's an income-related adjustment for prescription drug plan enrollees. And they're the same 6 tiers as Part B. The monthly premiums vary by state and by plan. Mail orders available, and lots of Medicare Advantage plans include prescription drug coverage. All right, entry points into the Medicare system. There are 4 main ones, and those are the ones that we're going to talk about today. First one is the initial election period, is when you're first turning 65. If you have nothing else in place like employer coverage, this period would apply to you. You're turning 65, you have a 7-month window of opportunity. The 3 months before your birth month, the month of your birth, and the 3 months after. If you sign up anytime within the 3 months before your birth month, Medicare will start on the first day of your birth month. So if you're an April 19th baby, and you can sign up as early as January 1st, January, February, March. If you sign up in any of those 3 months, it will start your Medicare on April 1st. If you sign up in April, it'll start in May, June. But the last 2 months of your window, June and July, if you wait, Medicare will delay your entry into the system. Now, you won't be penalized, you'll just be delayed in getting your insurance. And so we want to avoid that if we can. Our best advice to you is to sign up within the 3 months before your birth month if you don't have anything else in place. All right, the next type of period is the special election period. This relates to all the parts of Medicare, A, B, C, and D that we just talked about. The biggest one, the biggest special election period is leaving employer coverage. If you have employer coverage when you turn 65, you do not need to sign up for any of the parts of Medicare if you don't want to. Okay, you can if you want to, but you don't need to. And remember, Part B carries a premium, so why incur that extra cost if you already have coverage through your employer? The rule for the special election period, however, is composed of 3 parts. The first one is that you have to be actively employed. The second is that you have to be covered by your employer's plan or married to the person who covers you. So you could be married to that person or that person that's actively employed. And the third is that there have to be more than 20 lives on the employer's policy. Those are the 3 criteria to exercise the special election period and avoid signing up for Medicare when you first turn 65. The next period is the annual election period in which we find ourselves right now. It runs from October 15th to December 7th, and it functions in a very similar fashion to your employer plan, where you sign up in the fall. Your new plan starts on January 1st. That is exactly what happens here. Between October 15th and December 7th, you can sign up for a new Part C or a Part D plan, a new Medicare Advantage or a prescription drug plan during this time frame, or you can initially sign up for one of those during this time frame. It will start on January 1st, and you're expected to stay in that plan for the full calendar year. During that calendar year, you're going to have a new AEP, a new annual election period, to sign up for the following year. The last one is the general election period, and this is for Part B only. Let's say you forgot to sign up for Part B. You went on vacation and you came back and you had missed this opportunity to sign up for Part B. We have to be careful with this one. You don't want to have a general election period or use this general election period, but it's available for you if you want to do that. Here's a story for you. I got an email from someone on April 8th, and he said, hey Dan, I just got back from vacation. It was a long one, and my COBRA plan told me that I had to sign up for Medicare. So I went into the Medicare office, Social Security, and they told me that I had to wait until January 1st of next year to sign up for Part B. Is that true? Yes, it is. This general election period is from January 1st to March 31st. They're very strict about it, and so we have to be very aware of it. Okay, January 1st to March 31st. He said not only that, they told me that I will have to wait for my insurance to start. They're going to delay it until July 1st of the following year. Now it's April 8th, so he has to wait a full year and go all the way to July 1st before he can have this very basic insurance. Not a good deal. And the last thing he said is they're going to charge me a penalty for being without the insurance for a year, and that penalty is going to go with me for the rest of my life. Is that true? Yes, it is. So we try to avoid this Part B, this general election period, at all costs. All right, and you're now aware of it. If you have questions about it, please give my team or me a call. We'll get you straightened out. Again, though, if you have employer coverage and you have those three conditions, you do not need to sign up for Part B. You will not be penalized. Okay, leaving employer coverage, the big special election period, right? This is for individual plans. You can't have an individual plan because it's less than 20 people, right? COBRA and retiree, these are not employer coverage because why? Because you're not employed. COBRA technically is employer coverage, and it may have greater than 20 lives, but you have to be actively employed, right? That was the issue with the fellow who called me on, emailed me on April 8th. He wasn't actively employed. Problem. So you need to get Part B if you have COBRA or retiree plan. Secondly, you're leaving the nest when you leave employer coverage. They're not going to allow you back in usually. Most of the plans will not do that. 98% of them will say, no, you know what, thank you very much for your years of service, but you're on Medicare now. Let them take care of you. Family considerations. If you're employed and you have family members with you on the insurance plan, what happens to them when you leave? Medicare is individual insurance. It applies to you only. You qualify, you can have Medicare, but you can't take your family with you. So you'd have to go out onto the open market and find something for them to have insurance, which is important as well. Of the three things that happen to us as we age, hearing, dental, and vision are not, by law, allowed to be covered under Medicare. So, and I'm talking about the routine stuff, not macular degeneration or cataracts, things like that. Those are covered under Medicare, but the routine stuff, that's not covered by Medicare. So if you leave your employer plan, it might be prudent to keep those two types of plans with the employer for as long as you can, because it goes to the dentist you know, it goes to the vision provider that you know, and so on. So you would keep those as long as you can, because really original Medicare does not include those. If you're making HSA contributions after age 65, Medicare will make your Medicare insurance retroactive for 6 months. So for those 6 months that you've made HSA contributions, you're going to get taxed because it's a tax deferred or a tax exempt contribution that you're making. And so if that's the case, you're going to get taxed on 6 months worth when you weren't expecting to do so. So that's a rude awakening. Just be aware of it. Really the bottom line is for you to be proactive. If you're turning 65, check all of these benefits with your human resources administrator, and they can tell you, you need to be on Medicare, and here are the other things that you need to be aware of. You're going to lose your dental and vision coverage. You need to think about your family, those types of things. So if you leave employer coverage after age 65, Social Security has forms that are kind of the get out of jail card free. They'll say, there'll be two of them. One will say, hey, I want to sign up for Part B, and the other one will say, don't penalize me. Here's why I don't have Part B. I had employer coverage. So you'd be good to go. We have those forms in our office. They're updated periodically, so you want to make sure you get the most current forms. Avoid the Part B 10% per year penalty. That's what it is, and it's 10% of $170.10. So if you wait 2 years, you're going to pay an extra $34. where everybody else is paying $170.10, you'll pay $204. And you need to do that, sign up for Part B, within 8 months after your employment ends. Okay, so you have some time to figure it out, but you'll be without basic insurance for that time. So we can time it, our team can time it so that your employer coverage or whatever it is terminates at the same time as your Medicare begins, and so you will have continuous coverage, no lapses. The Part D penalty is 12% per year, and it's 12% of what? It's 12% of that $33.37. Now, if you're without prescription drug plan coverage for a couple of months, it's not a lot of money, right? What's 2%, 1% per month? What's 2% of $33.37? It's 66 cents. Not a lot of money, but it's annoying to have to keep paying that out month after month. Okay, what's it this year? It's gone up to $35 base beneficiary premium, and so we avoid that too. After you obtain Parts A and B, you choose one of 3 ways to get your Medicare. The first way is just to stay with original Medicare, but you've got exposures, right? We talked about them. The $1,556 deductible for Part A hospital, $194.50 after day 20, $233 deductible, 20% coinsurance, possible Part B excess charges. So we look for ways to fill in those gaps. And the other 2 columns are ways to fill in those gaps. If you get original Medicare A and B, you still need to get a separate prescription drug plan, and we call those standalones, standalone drug plans. And then, like I said, there are 25 different standalone drug plans in the state of California. So that's option 1, original Medicare. Option 2 is known as a Medigap supplement plan. These terms are used interchangeably, but supplement is a very specific term in the Medicare world, and it refers to Medigap plans. They work in conjunction with original Medicare, which is why they call them Medigaps or supplements, and you pay extra. You pay over the $170.10 every month for a premium. These plans are standardized, and they are standardized according to a letter, which makes it confusing. The letters run A through N. There are, as I mentioned, additional monthly premiums, and the coverage levels run from A to N. The gold standard of them these days is one known as the G plan, and the G plan will fill in all the gaps that we just talked about and whatever other ones that we didn't talk about, except for one, and that is the Part B deductible. 2022, that deductible is $233. The G plan covers everything except that. So that's a supplement plan. Supplements do not include prescription drug coverage, so you have to pay separately for that still. Option 2, so Medigap supplement is option 1A. Option 2 is a Medicare Advantage plan. These most often take the form of an HMO. You select a primary care physician, and then you get all the benefits of Medicare, plus lifestyle benefits like gym membership, over-the-counter benefits, transportation, acupuncture, chiropractic, sometimes dental and vision. All right, so those are Medicare Advantage plans. These are your options under an infographic type of model. And so you can have original Medicare A and B plus a prescription drug plan. You can add in a supplement plan, but it does cost a few dollars to do that. So that's the most expensive way to go, but it gives you the greatest flexibility. The other way you can go is with a Medicare Advantage plan, option 2, A and B, all the benefits under A and B plus prescription drug coverage most often. A little bit more about supplement plans. You can get care from any doctor who accepts Medicare, so you can see Dr. Seth in Cabot Cove, you can go to Dr. Gray in Seattle, you can see Dr. Jones in Newport Beach. There are monthly premiums associated with it. The plans are standardized, so a G is a G is a G no matter which company you go to. It's the same benefits, but the pricing ranges from anywhere like $125 to $480 per month, depending on your zip code, your age, and the standardized plan that you pick. People look at supplement plans in 3 ways when they're out shopping. The first is, how much is it going to cost me? Plans can vary widely in their premium, their monthly premium, based on their claims experience in that zip code with that age demographic. So it's beneficial to look at what the cost is because they are standardized plans. The second thing is reputation. This company treated my mom really well when she was ill. I want them. I don't care if it's an extra $10 a month, that's fine. And the last thing is underwriting. If you're outside of a window of opportunity, which is within 6 months of getting your Part B of Medicare, then the insurance companies will ask you a series of medical questions, and they call that underwriting. Depending on your answers to those questions, you may get declined. They can decline to offer you coverage in the Medicare world. There are pre-existing conditions, so we want to avoid underwriting if we can. And if you're within 6 months of getting your Part B, they won't ask you those questions. These plans are considered portable. They work for snowbirds, people who have homes on 2 coasts, and happy wanderers, those folks who like to hop in their RV and go visit the grandkids in Tennessee, Wisconsin, and points beyond. So you still need a separate prescription drug plan with a supplement plan. So key points to remember: you do not have to enroll in Medicare if you have employer coverage. Parts A and B exclude prescription drug plans. Part D, A and B alone leave you exposed to unlimited out-of-pocket risk, and so you have to, it's beneficial to pick up a supplement or an advantage plan to fill in those gaps. There are ways to fill in the gaps called Medicare Supplement plans, prescription drug, and advantage plans. We sell all of those plans. Higher income beneficiaries, you're going to pay more for 2 parts of Medicare, Parts B and D, and you can make changes to your Medicare plan choices every year, at least Part C and D, during the annual election period, which this is what we're in right now. We only have 17 days left. In California, you may make changes to your supplement insurance in your birth month, so it's different from the Part C and D. The supplements are during your birth month, because what the insurance carriers will do is they'll send you a birthday card, happy birthday, here's your new premium. So you're able to change those plans because you have advance warning that your premium is going to be not as reasonable as it was when you first started out. Leaving employer coverage warrants advice and consideration. We're happy to provide that information at no cost to you. And I think that's it. I'm going to leave you with some contact information, and if you have any questions, please put them in the chat box and I'll be happy to answer them. The office number is 714-289-1099. And our first question is, if I never contributed to Social Security, do I only need Part C? Well, that's a trick question, isn't it? If you never contributed to Medicare-covered employment, then you're going to pay for Part A, and you'll still have to pay for Part B. Social Security is the income side of things, and Medicare, there are 2 taxes that you pay on your payroll. 7.65% goes to Social Security, and well, no, I don't think it's that much. I think it's 1.2% goes to Medicare. And so if let's say you're a teacher. Teachers have their own retirement plan, right? So they don't pay into Social Security. Municipal employees like firefighters, they don't pay into Social Security, so they have their own pension plan set up, PERS, CalPERS. But we, as firefighters and teachers, we continue to pay into the Medicare system. So you probably have paid into Medicare. You're entitled to Medicare Part A. You would have to still pay for Part B to get a Part C plan. A and B are your foundation, and then from there you can move forward. So Part C is an alternative to original A and B, but you have to have A and B. Next question is, how would you pay for Part B? I'm sorry?
If you didn't contribute to Social Security.
If you haven't contributed to Social Security, how do you pay for Part B? They will bill you every 3 months. So they'll say, here's your bill. We're going to do a true up because we're outside of the normal cycle that everybody else pays, January, April, September, October, something like that, maybe July, October. And so you've got an extra month. We're going to add in that extra month and bill you for 4 months this time, and then we'll get you onto the same cycle as everyone else. That's how that works. If you are drawing Social Security and it's enough money to cover that 170.10, they'll just take it out of that, your Social Security. Thank you for the questions. They're helpful. Thank you. Does your company only handle Medicare insurance? No, we have a couple of agents who also work with the individual and family plan market. That is the non-Medicare market. We also dabble in travel insurance if you're interested in doing that. But our primary focus is Medicare. We can help you with the individual and family plans. We don't do Covered California, which is the subsidized form of insurance for California, though. Any other questions? Okay, so the office number, again, is 714-289-1099. If you have any questions, leave a message and one of our team members will get back to you quite quickly. We are in a bit of a frenzied time right now, so waiting until December 6th is probably not the most prudent course of action because I guess there are a number of people that like to wait until then. So if we can hear from you, that'd be great. We're happy to help you with whatever your Medicare needs are. I appreciate your kind attention this morning, and I hope to talk to you soon.